Hi, and welcome to Vetsplanation. I'm your veterinary host, Dr. Sugerman, and I'm going to teach you about veterinary medicine. In this podcast, we can dive deeper into the understanding of what our pets are going through and break down medical terms into easier to understand chunks of information. Just a quick disclaimer, this podcast is for informational purposes only. This is not meant to be a diagnosis for your pet. If you have questions about diagnostics or treatment options, please talk to your veterinarian about those things. Remember, we are all practicing veterinary medicine, and medicine is not an exact science. Your veterinarian may have different treatment options and different opinions. The information I provide here is to help pet parents have a better understanding about their pets. If you like our podcast, please consider sharing this podcast with at least one friend or just somebody else who has pets as well. Now, let's jump into this week's episode. All right, welcome back to Vetsplanation. So I have Dr. Z back with me again today. So for those of you who don't know Dr. Z, she works during the day as a general practitioner, and I call her the diabetes expert. So she she is definitely really good at diabetes and my go-to resources when I have questions about them. All right, so we're gonna jump into what is diabetes.
Hey, yeah, excited to be here. And I listen to lots of podcasts. This is
Perfect.
like super exciting for me to actually be on a podcast.
You're like famous now.
Anyway, what is diabetes? So, diabetes mellitus or mellitus is what we're talking about. Mellitus or mellitus, I don't know. I think the British say mellitus.
Yeah, exactly. I see the two different ways.
Yeah. Anyway, it means sweet. That's what mellitus means. And actually, it goes back to when people first discovered diabetes, like as a thing. They diagnosed it by tasting the urine.
Yeah,
And,
gross.
and it was sweet. And they're like, oh, this is diabetes mellitus. So, yeah, sweet urine is what it means, basically. There's also diabetes insipidus, which is totally different. We're not talking about that today, so I won't even go into it. So we're talking about the DM or diabetes mellitus. And it all comes down to the pancreas, and that's the little organ that lives next to our first part of our small intestine. It has two main functions. First, to digest our food, especially fats. It helps secrete stuff into the intestines to help digest that food for us. And it also has these little islands that live in it. They're called the islets of Langerhans.
It's a great name.
Fun, yes. Some dude named Langerhans discovered them. And that's where the insulin is produced inside the pancreas. And in those islets are these specific cells that produce the insulin called beta cells. And I'll be talking about those a little bit.
Okay. So remember that name.
Yes, the beta cells. You don't have to remember the islets of Langerhans, although I like saying it.
Right.
Anyway, the pancreas makes our insulin. And the insulin, what does it do? It drives glucose into our cells. And I don't know if any of you remember the Krebs cycle back in science class, but that's our main source of energy, right? Glucose is like the smallest part of sugar, and it's not gluten. It's totally different. Right. Glucose is sugar.
Yes.
And it's our main source of energy. And so once it gets from our food into our bloodstream and then into our cells, that's where we start to use it to make all our cells work and make all of our various organs do everything. So it's essential for life, right?
It's a very important tiny organ.
Yes. Tiny molecule, I guess.
Yes, true.
Say.
Yes. I was thinking the pancreas is,
Oh, the pancreas is also important.
Yes.
Yeah. So that insulin helps, us get that glucose into our cells so that it can work. So if we don't have insulin, those little gates on our cells aren't working to bring the glucose into our cells. And then that's where the whole problem with diabetes happens is we can't use that glucose anymore. It's just in our blood, but not getting into our cells. Insulin also helps our liver metabolize fat properly, and it helps us maintain our muscle mass. So besides being like used for energy, it also helps with those things. So those things also start to malfunction a little bit when we have really bad diabetes going on. So I was going to go into where glucose comes from. Again, it's sugar, but there's different kinds of sugars. Like in fruit, there's fructose, and the table sugar that we put in our coffee is sucrose. But all of those basically break down back into glucose once we digest them. So if the glucose stays in the bloodstream, then we have too much glucose in our blood not going anywhere. And our kidneys can only handle so much glucose. And so when there's too much glucose in the blood, it starts to spill into the urine, like it overflows those kidneys. And then we get all this glucose going into our urine. And I don't know if you also remember osmosis.
Yes, yes,
That's another thing that is
yes.
important when you're thinking about diabetes, because glucose is like a a molecule that water wants to follow
Right.
because it's big. Yeah, it's big, and the water just always wants to dilute things and moves where lots of those molecules are. So when we have all that glucose in our urine, water follows it into our urine. And then we have to pee a lot because suddenly
Right.
we have all this water going into our pee more than usual.
Mhm.
And then pee all that out. And then we're like, I'm thirsty. I just peed all that water out. And so then you're just
Yeah.
chugging, drinking
Right.
water. And then you're doing the same thing. It's all just going into your pee because it's following the glucose that you can't get into your cells. And so those are the main symptoms of diabetes is you're super thirsty and you're peeing a ton.
Mhm.
And that's sometimes the first thing that people will bring their pets into me for.
Right.
Like my dog's peeing all over the house or my cat's peeing out of the litter box and or I'm starting to scoop the litter and it's got these huge heavy balls of clumped litter instead of the regular size normal urine clumps.
Yeah.
So that's like one of the first things we see. And then we also lose muscle, we lose weight because we can't use that glucose, that energy.
It's a lot of muscle weight too, right? Not just
Yes,
regular.
because glucose helps make our muscles work properly
Right.
and stay bigger. And then we can't store our fats properly. And I think that's when you end up seeing these
Yes.
diabetic
Yes,
patients that are
exactly.
completely out of control and our livers are trying to find an alternative source of energy. And so it starts punching out all these fats and then patients can get ketoacidic from that. And then they get very sick and they die. So,
And we'll do DKA on another one.
okay. Yeah,
Yes.
that's your realm.
Yeah.
After you've fixed them,
Yeah.
then I take them over.
Yes, you do all of the long-term management, and I definitely cannot do.
Yeah. So
So
then that's when I take over and try to keep them from going back into that
right.
acidotic state. A couple more symptoms of diabetes besides weight loss and muscle wasting, and of course, drinking and peeing a lot. Their hair coat tends to have problems. You get a thinner hair coat. We have all this extra sugar in the blood. And so if there's a cut or a wound, it's really slow to heal because
Mhm.
there's bacteria loves sugar too. And
Yes.
so it's more likely to fester and get infected.
Same thing if there's bacteria in the urine, right?
Yeah. So there's also all this sugar in the urine. So you can imagine if you're peeing a ton, leaking urine a lot, and it's sugary urine, you're going to be a little more prone to getting urinary tract infections.
Yeah.
Bacteria just has a good time up in that bladder. In dogs specifically, also, they can get cataracts in their lenses in their eyes and they can go blind almost suddenly. Like it can happen in a matter of days. Sometimes it comes on more slowly and you notice like cloudy eyes, but then boom, they're usually blind.
Wow.
Even well-regulated dogs tend to eventually get cataracts when they're diabetic, unfortunately.
Yeah.
If it's a young dog that's diabetic, which we see sometimes maybe 5 to 7 years old, and suddenly they get diabetes and suddenly they go blind, it can really deteriorate their quality of life a little bit
Yeah.
because they're not used to suddenly not being able to see.
Right.
I think dogs can still live a happy life being blind. But if you're a younger dog that's well regulated, there is eye specialists out there that can remove the cataracts, just like in people, do cataract surgery,
Nice.
and then they can see again.
Yeah.
So we can fix all of these things.
Do you do like eye medications for the cataracts, or do you usually send them to an ophthalmologist for that?
Good question. So if I'm suspicious of a problem, like cataracts in themselves aren't painful, you just can't see very well. But sometimes, especially when they come on suddenly, there can be a secondary inflammatory response,
Mhm.
either inside the eye or around it. And so they can get glaucoma or uveitis, like one or the other, lens induced from the cataracts. So uveitis is inflammation in the fluid inside of our eye.
Okay.
Um, so behind the cornea, sometimes when you're looking with the light, you can see things floating in there.
Yeah.
And that's like pus basically and inflammatory and blood
It's
sometimes.
terrible.
Yeah, it's
Yeah.
very painful. Um, and then also glaucoma is when the pressure increases. So you have maybe so much inflammation that maybe it stops up the normal flow of the fluid inside the eye. And then the pressure can just build and build and the eye gets bigger and very, very painful as well.
Mhm.
And
A lot of
there-
times you see them coming in as like squinting their eyes,
yeah,
right?
squinting, red eyes, bulging eyes, pawing at their eyes, all of those
Yeah.
sort of things are indications that they're uncomfortable and painful. And
Okay.
so we can test those pressures, we can look in the eye,
Mhm.
and there are drops that can help. but it's always good to go to an eye specialist.
Yes.
I
I feel
mean,
like
we
eyes
can
are
be
like
like, yeah,
a very special thing. You're just like, you should really see an
yeah. I'm
ophthalmologist.
like, here, let's try this job while you go and make an appointment
Right.
for the eye specialist.
Right.
That's usually what I say. Plus, it's good to when you're diabetic and have cataracts, it's good to maybe just get a consultation and be like, see if the eye specialist thinks that the dog is a good candidate for surgery.
Mhm.
Sometimes they're not. Like if they're too old or they're really sick and have a lot of other problems
Yeah.
on top of the diabetes, it may not be worth putting the dog through a cataract surgery. And it's expensive. It's probably like 2,000-3,000 an eye to do
Yeah,
it.
that's kind of expensive. Yeah.
Yeah.
But I mean, if
So
it's a young dog, I definitely could see how that
yeah.
will help improve their life.
Yeah. If you have insurance.
Yes. Right. Exactly.
And you bought it before they became
Yes.
diabetic,
Yes.
then you're golden.
Do you happen to know, just off the top of your head, do you know why cats don't get cataracts?
I don't. I'd have to look that up.
That was
There's
really interesting.
something about,
I thought it was the way that they stored lipids in the eye or something like that. But
yeah, I think you're right. Vaguely remember that. I didn't actually look.
that's okay. I was just curious if you knew.
I don't remember. No.
Okay.
Just seems to be a dog thing.
Weird. Okay. And then, so
Yeah.
what animals can get diabetes?
Okay. Any animal that has a pancreas, and lots of animals have pancreases actually.
Yes.
So it's mostly mammals are the ones that we deal with, like dogs and cats, humans, obviously, but also birds and reptiles and amphibians have pancreases. And I was actually skimming or Googling about that. And there
Yeah.
are reports of like
Mhm.
lizards with diabetes and that
Yeah.
sort of thing. Yeah.
It's super interesting because, like, we just don't do a lot of testing for it because
Yeah.
usually somebody comes into the ER with a lizard. It's, do I want to spend $200 for this lizard to be seen for like minimal diagnostics and
Yeah.
stuff? But I feel like there's probably a lot more diabetes in things like lizards and
Yeah.
birds and
It's-
stuff that just aren't reported yet.
yeah. They just probably die. And
Right.
that's why they died.
Yeah, exactly.
Nobody ever knows.
Nobody knows. You just
Yeah.
died. And you're like, oh, it was an exotic.
Maybe
I don't
like
know why.
half of them that die actually died of
Could be. You start researching this. You start seeing all the diabetic lizards.
I know. Thanks. You go ahead.
So are there different types of diabetes? Like people always talk about, they're like, I'm a type 2 diabetic or I'm a type 1 diabetic.
Yeah.
So are there different ones in animals?
Yeah, absolutely. So let's review the types so that we can understand them a little bit. Type 1 is complete dysfunction of those beta cells in the pancreas. So there's just no more insulin ever. That's type 1. Type 2, there's some beta cell function. So you can make a little bit of insulin,
Mhm.
but it's pretty impaired. And you plus or minus have what we call insulin resistance, like that insulin just doesn't work as well anymore in our
So
bodies.
it's there, just not working correctly.
Yeah,
Okay.
for many reasons that I'll go into. It's just our cells are becoming resistant to that insulin, and it's just not, even though it's there, it's not getting into the cells.
Got it.
The glucose isn't getting into the cells despite the insulin. So yeah, it's like a in between diabetes. Type 3 is you have a perfectly normal pancreas and normal beta cells, but you just have sudden and extreme insulin resistance. Like even though you're making it, it's just not working on your cells.
Huh.
So it's pretty unusual.
Yeah.
That's a thing. There's type 3. And in my opinion, there's a bit of overlap among all these types. Like sometimes it's not always black and white.
Is there like a test you can do to be like, this is type 1 diabetes, this is type 2 diabetes? Sure.
I wish there was, but
Right.
not
It's
really.
not, right?
Yeah.
It's like I could
And-
see a lot of overlaps there. Yeah.
Yeah. And cats, especially, I wish there was a test
Yeah.
because there's that new medication, which I'll go
Right,
into.
right.
But yeah, no, it's always you're uncertain. But in general, dogs are type 1. Like
Okay.
we don't ever really see type 2 in dogs. They usually always need to have insulin treatment.
Okay.
Because they just can't, they don't ever make any again on
Got
their own. Cats, if we're lucky, they can be type 2. And sometimes they can even go into remission and not need insulin anymore if we jump on it right away and are really careful with our monitoring.
Nice.
I was going to say insulin resistance is usually caused by some sort of chronic inflammation happening
Okay.
or infections anywhere in the body. So urinary tract infections, severe dental disease with an abscessed tooth, terrible skin infection, flea allergy, dermatitis or something,
Right.
and their whole body is just a big hot mess, then that can increase your insulin resistance and it doesn't work as well. And so you have to give more for it to do anything.
So some other sort of illness, essentially, or something that's causing
Yes.
some inflammatory response.
Yep.
Or
Yep.
okay.
Absolutely. That can all cause insulin resistance.
Yeah.
For type 3, think really short-term insulin resistance. So it's usually caused by hormones. There's gestational diabetes. You've probably heard of that in
Yes,
people.
absolutely.
I think that can happen in dogs and cats too. It's just so transient that we probably just miss it and it resolves on its own.
I'm sure if the dog was drinking a lot while I was pregnant, I wouldn't think anything of it.
Yeah,
If
it's
it was
like
peeing, my wife drank a lot and peed a lot when she was pregnant too.
yeah.
So
I imagine they wanna treat people that did it. I don't know, but
yeah,
because I remember they were screening for it when I was pregnant,
they still
but
screen for it now. Yeah, they
yeah,
do
yeah,
always constantly screen for it. That's definitely not something we really do for animals, which is
yeah,
interesting.
yeah, so it's just real transient, and I was thinking when I was looking up this stuff, those cats that come in that are super stressed,
Yes.
I actually think that's, like, a really short-term type 3 diabetes because
Yeah,
like,
definitely, right?
the cortisol can influence
Mm.
the insulin resistance, and so it's basically I think it's their body's way of getting ready to fight or flight.
Exactly. They're
They
like
need that
getting their
sugar.
glucose ready. Yes.
Yeah, although they're not letting it go into the cells, I don't know.
Right.
So it's counterintuitive there, but it obviously gets better, and
Right.
then they will revert back to normal insulin non-resistance, and they'll start going back into their cells. So it's a very temporary thing. Just basically forget type 3. We're really just talking about type 1 and type 2.
Okay. I don't even think that people talk very much about type 3 just in like for people, even in
Yeah.
general.
Other than the gestational one,
Yeah,
maybe. That might be
exactly.
the one that people
Mhm.
have heard about it.
Right.
Yeah. So yeah, dogs are type 1, cats get type 1 or 2, and if we're lucky, they're type 2 and then won't need insulin anymore.
So with animals, like we've been talking a lot about sugar and like people, they always talk about how it's like the sugar disease.
Yeah.
So does this really have anything to do with sugar in animals?
No, for one, they don't usually eat that much sugar anyway. Although in kitties, if they're overweight, that can predispose them to diabetes because it does cause some insulin resistance just by having more fat cells. Keep your cat lean. That helps
Yes.
prevent diabetes.
We should have
Specifically.
that as a poster, like prevent diabetes, keep your cat lean.
Yeah.
So I know we talked a lot about like insulin stuff so far, but is there anything other, like anything else, like foods or anything that can help with diabetic animals?
So for dogs, unfortunately, no. Again, they're type 1. They always
Right.
have to have insulin treatment. Although the food can help as far as like not spiking that blood sugar up too high, and then you don't need as much insulin to get it back down.
Yeah.
So in general, we recommend like higher protein, higher fiber, less carbs, less simple sugars.
Yeah.
So avoid like fruits and white rice and white bread when
Mhm.
you're giving your dogs treat. And
More
there's
like higher protein type
yes,
stuff.
higher
Mhm.
protein. So a piece of meat is totally fine. That's not going to jump their blood sugar
Yeah.
up. And there's prescription foods that target that kind of idea as well, both for dogs and cats. For cats, they're carnivores. They're meant to eat meat. So I don't think the high fiber diets are really that good for cats.
Yeah.
I recommend more high protein foods for
Mhm.
them to help manage their diabetes. And
It helps manage their weight too, right?
yes, it
Yeah.
helps them stay lean. So for cats, again, they're sometimes type 2 and they have some residual beta cell function and some insulin still that they're making on their own. So usually if we start insulin right away, they have a better chance of going into remission and those beta cells can recover and go back to normal more easily. But there's a new medication actually that came out for them. It's called Bexacat and it's just an oral pill. You don't have to do insulin shots anymore. And this drug is really weird. It works on the kidneys to prevent them from keeping that sugar in the blood. So
Huh.
basically, they just pee all that extra sugar out.
Yeah.
So that they normally have high blood sugar in their urine, right, when they're
Right.
diabetic, but now they have even more
More sugar.
sugar going into their urine, and then it stays down in their bloodstream. So it's cool. It's a new drug, and I haven't yet prescribed it.
Does that mean they are more likely to get more urinary tract infection because now there's more sugar in their blood?
Yeah, so I thought that would be a thing, but
Mhm.
there's one big study that came out on the Bexacat, and they did it on like 84 cats or something, and they did not see an increased incidence of UTIs, which was
Hmm.
interesting.
That is interesting.
Yeah, and their PUPD, the excessive drinking and
Yeah.
excessive urination, actually improved, which doesn't make a lot of sense to me because I feel like the osmosis would still be
Right.
happening
You
and they
have a
would
lot
still have to
more.
pee more.
Right. Exactly.
But I think it's because they started recovering, right?
Mhm. Right.
And their beta cells started producing more insulin. And so they, over time, had less sugar going into their urine, actually.
Interesting.
And so also, I think there's something about having high blood sugar that makes you thirsty as well.
Mhm.
So the fact that the blood sugars were returning
Lower.
to
Yeah.
normal, even though we had a lot of sugar in the pee, it was improving over time and they were less thirsty in general. So the PUPD improved and then they didn't tend to get more UTIs. It was just one study so far.
Yeah, we got a lot more studies
So
to
I
do on
still
the right.
think over time, I'm going to be screening these guys for UTIs for
Yeah,
sure.
for sure.
Yeah. Yeah.
And so this will only work on our type 2 diabetic cats, correct? Not
Yes.
type 1.
Yeah. And that's one big thing that the Elanco, I think, is who came out with this drug. They're saying we have to select our patients very carefully. The cat can't have had any insulin treatment, has to be a new diabetic, has to be otherwise pretty healthy cat, because those are the ones that are more likely to be type 2 and more likely to have a chance of making their own insulin again.
Mhm.
Because if you give it to a cat that's type 1, and it's going to probably go into DKA with normal blood sugar, and that's going to be really hard for you guys.
Yes, that'd be very difficult for us. Yes, I know.
But
I've
now,
been waiting for that Mexican
yeah,
cat to come in and be like, "Are you diabetic? Are
yeah.
you going into DKA? What's happening?"
So there's this new ketone test
Yeah,
that we have the
we just
glucometer
got.
now. Yeah.
Yep.
So it's an earlier detection of those ketones. So before
Right.
they go into DKA, you can see that number getting abnormal, and then you
Yeah.
can realize that this might be a type 1 cat and
Yeah.
we have to give it insulin.
Right.
So the two big things for you to remember are, number one, this is a thing now. You
Yeah.
can have DKA with euglycemia or normal blood sugar. And then number two, these patients need insulin. So even though their blood sugar is normal, you got to give them insulin
Right.
and maybe supplements of dextrose until the drug wears off or whatever.
Right.
And it does only last about 24 hours. So the blood sugar would expect to start climbing again after stopping Bexacat. Yeah.
Super interesting drug.
Yeah.
And super interesting, all the things that we need to know about it now, too.
Yeah. Oh, I know. It's fun. I'm excited about it.
Yeah. I'm glad you are. I'm not as excited on my side, but I'm excited for the cats that
Yeah.
it will help.
And some, it's not for every cat. And then the ones that it just doesn't work, you just have to go back to insulin, and they can still be treated pretty successfully with it. So.
Can they go, and they can go back into remission on the Bex cat, correct?
Yeah, that's the thing is, okay, when do we know that they're in
Right.
remission? Because their blood sugar is always normal.
Right.
But it does only work on one part of the kidneys. So like they can never get hypoglycemic, which is cool.
Interesting.
We're not worried about the hypoglycemia so much with these cats. The only way to know, they will always have sugar in their urine too.
Yeah.
Like that never improves because that's
Right.
what the drug is doing. Even for a normal cat, it's making sugar go into the urine.
Got it.
So we can't be like looking at that to decide if they're in remission.
Yeah.
The only way to know is to stop giving the Bexacat,
Mhm.
maybe 6 to 12 months after you
Yeah.
start it, and watch and see
See.
if their blood sugar climbs up again, and they still need it.
Yeah.
If it doesn't, hey, they're in
That's great.
remission, then we can stop.
It's super interesting.
Yeah. Yeah. Diet is important though. Yeah. It does help
Mhm.
decrease those swings of the high blood sugars. So you don't need as much insulin.
Can you
Low carb.
do, when you're doing like the Bex cat, do you do the diet as well?
Then it doesn't matter.
Doesn't
Yeah.
matter. Okay.
But the little bit of CE I've been to
Yeah.
on it are saying it's not as important. In general, though, I like high protein diets for
Yeah.
cats. I
Right.
like canned diets for cats.
Mhm.
Cats that are on insulin, I recommend them being on a canned only diet,
Mhm.
at least initially, because it just has lower carbs usually
Yeah.
in that food and higher protein. Plus, moisture is really good for cats. They don't
Mhm.
usually drink as much as they should, and it helps them stay lean and hydrated.
Yeah. What diet do you usually ask them to go on to?
Oh, there's a few prescription ones out there. The Purina DM actually is a really good one. The canned has got nice high protein and low carbs. There's also Royal Canin Glycobalance, which I don't like quite as much. And then I think Hills makes one. They have a WD for dogs, but the MD is better for cats
Okay.
because that's the higher protein one.
Right.
It's more like, just think Atkins diet.
Yeah.
That's what cats should be eating.
Yep. Do you ever have people who like make their own diets for them at home?
Yeah, certainly you can do home cooking. I like balanceit.com for
Yeah.
that. It helps you keep the food nutritionally balanced. They give you like a supplement to add to your recipes. And then I can go in on I have my own login for balanceit.com.
Oh, nice.
And I can request a specific disease diet. So like I can
Nice.
look for a diabetic one and send
Yeah.
the owner recipes that are for that specific
Well,
one.
it's amazing.
Yeah.
Very cool. I knew that they could go in, but I didn't know that we had somebody go in as well.
The public can go and get
Mhm.
recipes just
Right.
for like normal dog and cat food.
Yeah.
But like for a disease process, I think they require a vet to get
Got
involved.
it.
So I have to go in and either approve one that they look at,
Mhm.
or I can just send them recipes on my end.
Very cool.
Mhm.
Okay.
Yeah.
That's awesome. So I know we've talked a lot about what diabetes is and stuff, but how do you diagnose diabetes in the first place?
Oh, yes. Good question.
Mhm.
So basically lab work, that's what it's there for, right? So blood testing and urine testing are how we would diagnose it. You would see high blood sugar on the blood panel and
And
then sugar in the
how
urine.
high are we talking? Like just a little bit above or?
Good question. So the normal range is probably somewhere around 70 to 180-ish or so, probably for both dogs and cats. Cats can get stressed, and again, that can cause a higher
I think
blood
it's like
sugar.
300 and
Yeah.
yeah.
I'd say 250 to close to 300. I could cop up to stress.
Yeah.
300 would be my cutoff. If it's higher than 300 in a cat, I would be suspicious.
Yeah.
For diabetes, for dogs, absolutely. They don't usually get that stress response, not as much as cats anyway. And so if they were over like 250 to 300, I'd be very concerned about
Yeah.
diabetes. But usually you also want to see it in, you don't want to see it, but it will go into the urine. And so when you're testing the urinalysis, you'll also see glucose in the urine. Cats that are stressed, it'll transiently go into the urine and then
Right.
it'll resolve when their blood sugar goes back to normal. So it's not always 100% in a cat. There's another test called a fructosamine test.
Yeah.
That test is like the average blood sugars over the past few weeks.
Mhm.
Is what it does. I think it's similar to the A1C in people. I've
Right.
heard people talk about that test.
Yeah.
And then I think they've actually tried testing that on dogs and
Mhm.
cats too, but it's not as reliable. Like
Right.
it's not as good information. So we usually just use the fructosamine for dogs and cats. So if that number is high, like if it's over, I think 300 or so, that's usually indicative of diabetes. A normal patient without diabetes would probably be in the 200s, less than 300.
So what if you had let's say a cat that came in was over 300, that's just like 350 on the regular,
The
just
blood
regular
sugar.
blood sugar.
Okay.
And then would you do fructosamine that day or would you have them come back to recheck the blood work later on to see if the glucose was normal later?
I guess it depends on the situation.
Like the clinical signs?
Yeah, if they were
Mm.
telling me that their cat pees out of the box,
Yeah.
I'd be like,
Yeah.
oh, it's probably diabetic. I would just do a fructosamine right then and there.
Okay.
It's easy because we have it in house, so I
Right.
can just know right away. So I would probably, in all of those cases, probably run it.
Yeah. Yeah.
Unless it was like a really young cat that was here for its neuter and it had a 280 blood sugar
Mm.
and it was like screaming its head off when we sedated it. I'd be like, no, that's probably
It's probably
stress.
stress.
I'm not going to bother with the fructosamine.
Got it. Okay. Perfect.
Yeah.
Real quick too with I know you're talking about like in the urine. If you see ketones in the urine, will you do fructosamine right away?
Oh, ketones and glucose, like both of
Ketones
them are
and
there.
glucose.
Sure, I could probably do fructosamine at that point.
I
But
talk a lot with my technicians about looking at the urine because if the urine is discolored and it shows ketones in there, a lot of times it's because the urine was discolored. Like if
oh,
it's
so it's like a
bloody,
false positive.
false positive.
Okay.
Yeah. When it's like a really bloody one or like an orangish color, like it'll actually like
Mhm.
give you a false positive.
Yeah, if it's not a sick animal, I'm not so
Yeah.
worried about it.
That's all I see. So,
Okay. Yeah. I'm usually sending the pee out a lot more than you two, so I can
Sure,
trust the
that's true.
results a lot
Yeah,
better.
absolutely. A lot of times I think at the lab they spin them down and then they run it if I remember correctly.
Yeah, or
They
they
do
double
something
check
different.
it.
Yeah.
Yeah. I did say it's confirmed or whatever.
Right. Right.
There's been some where there's no sugar in the urine and the ketone is positive.
Yeah.
And then they actually put a note saying this is usually not significant in a patient that doesn't have glucosuria. I don't know. I always take that with a grain of salt.
Yeah. Absolutely.
Yeah.
Okay. And then, so we talked about like the treatment of diabetes, about insulin, but can you tell me more about insulin, like types of insulin, how often we give it, things like that?
Yeah. So basically, dogs need injections of insulin every 12 hours and then the diet together with that. So low carb, high fiber, high protein food. For cats, unless we're doing the Bexicat
Yeah.
or trying that, they also need insulin every 12 hours.
Okay.
And then the diet, again, I usually go to canned food only,
Mm.
high protein, low carb. And usually, if we're going to go with the canned food, any pate style is better than like the slices and gravy or
Oh.
whatever, because those gravies usually have a thickener, like there's some higher carb content in those kind of sliced up ones.
Yeah, that makes sense.
Yeah, so pates are better. And I meant to say when we were talking about the types of food for cats, there are plenty of over-the-counter canned foods that are good for diabetic cats, namely the Fancy Feast classic pate flavors. There's a ton of them out there. You can buy them at Fred
Interesting.
Meyer, and they're really good for diabetic cats.
That's so interesting. Most of the time, like when I was in vet school, they were like, "Fancy Feast is terrible. It has so much, fat in it." And
No, it's good
yeah,
stuff.
it's really interesting, right?
Yeah, I think I remember hearing that too.
Yeah,
Like,
yeah.
I remember
being
thinking
really
like
big.
canned food was bad for cats.
Exactly.
I feel like I've learned so much since then,
Right.
and canned food is actually really good.
Yeah, we used to say that always feed them dry food because that was better for their teeth.
There is something to that.
Yeah.
I do think the physical chewing on harder
Mhm.
stuff logically cleans their teeth. But if we have a cat with dental, you're getting me on a tangent.
Sorry.
But that's okay. Because I'll just tell you, I really like the dental diet for cats made by Royal Canin. Because that kibble is actually bigger than most cat food kibble. And it's got stuff in it that fights tartar and plaque, and it's spongier, and they really have to chew on it. And I feed it to my cat, and I'm like, yeah, brush your teeth. And it's like just chewing on those big kernels.
Right.
But I just limit that. I give it a little bit just to brush his teeth.
Yeah.
And then mostly what he's eating is the canned food because that's better for him.
Yeah. Nice. Oh, and then what are the types of insulin?
Yes, there's quite a few out there, and it's always more to learn, I feel like. There's short-acting ones, there's intermediate ones, and then there's long-acting ones. I think when they come in on DKA, do we have regular insulin?
Yep, we use regular insulin.
Yeah, so that's really short-acting. It starts working right away, and then it stops working right away. And I think that helps you get them out of their crisis when they're acidotic.
Which I think is very misleading for people because they're like, regular insulin? That's the regular insulin we would give, right?
Why is it called regular?
I don't know.
It's weird.
I don't know. But we definitely have had a lot of people who have accidentally given the wrong insulin because somebody said, "Oh, can you give their regular insulin?"
Yes.
It's like, give regular insulin.
It's a bad word for that.
Exactly.
It's a bad name.
Yep.
But yeah, the regular insulin is actually the shortest acting one. We only use it for short term when we're trying to get them out of the crisis. Once they're doing better and they don't have ketones anymore, then we want to go to a longer acting insulin. And so I usually recommend for dogs NPH, which I always have to look it up. That means neutral protamine hagedorn. That's another dude. Some person named Hagedorn made up this insulin. It's a synthetic insulin. It mimics human insulin. And there's a couple brands, Novolin, Humulin, and usually has the N on there. Those are the brand names for NPH insulin. And I think those work as first choice anyway for dogs really well.
Okay.
For cats, I like glargine insulin. Its brand name is Lantus, I believe. There's one other one as well. But glargine is a very longer acting insulin. And it just seems to work really well in cats.
Yeah.
And studies have shown they have a higher chance of going into remission if we start them on that one right away. So I really like gene for cats. And they come in different strengths and different concentrations. You'll see on the bottle U40 or U100. All that means is 100 units per milliliter or 40 units per milliliter. So as you can imagine, the 40 units per milliliter is a lot less concentrated. It's more dilute insulin versus the U100 is a little more concentrated. There's also these U300 ones, which I went to the, I didn't either. But we went to the AVMA conference a couple months ago or weeks ago. And there was this one internal medicine specialist doctor that was using both U300 and U100, like balancing them at the same time somehow. Like it was pretty complicated.
Whoa. Yeah.
But it was intriguing as well.
Yeah.
But I don't know.
It's so
I'm
confusing for the clients too, I feel like.
It's very specific. I think you need an internal medicine specialist guiding you on that plan.
Right.
And be able to monitor very quickly. So I don't use the 300. I just use mostly U100s. I don't really like the U40 insulins, especially for big dogs because it's so dilute. You have to use a lot of it. And insulin is pretty expensive across the board. And so you go through those vials really fast on a big dog. So I like the U100 ones. You don't need to use as much.
What about the pens?
Yeah, there's pens too. I've never used them. I think some owners have just went and done it on their own.
They've just done it. Yeah. Apparently it's supposed to be cheaper to get it with the pen.
Yeah.
And I haven't seen anybody use the needle to give it yet because I think the units are just so small. Like
does
it's just
it come with a needle?
It does. Yeah. It does come with needles, but instead they'll buy a regular insulin needle.
Oh, I see.
And then they'll just draw it up from the pen and then give it that.
Because it does have a rubber.
Has a rubber stopper.
You can just pull it out there. Yeah.
Yep.
So just use it like a vial.
Yeah. They just use it like a vial. Yep. That's it. Yeah. It's very interesting. Like apparently they're way cheaper than getting a regular insulin bottle.
Fine. Wherever you can find it. It's like I give you the prescription and you go shopping.
You find it. Yeah.
Yeah. So lots of types there. Also Vetsplanation is one of the U40 insulins. I don't like it because it's dilute. And also back in the day, it went on back order like indefinitely and suddenly. And I had all these patients on it and we had to change them over to a different insulin and kind of start all over with their diabetes. And it was really painful for a lot of people.
Yeah. Do you know why they went on back order by any chance?
Something with the facility where it's manufactured broke down or some tragedy happened at the plant. And then they just took a while to come back from that.
I feel like the carb because like that could happen to any insulin
Yeah,
company.
but I feel like Vetsplan's a smaller company, and
Yeah.
so I don't know. And they've claimed it's never going to happen again. There's protamine zinc or PZI is
Oh, yes,
another
I've
type
heard
of
of that.
insulin that's also now human, and it's also U40. So I just don't usually prescribe that one.
So I do a lot of the short-term stuff, and then I get to hand it off to you. So
Yes.
what do you do for like their long-term care?
Yeah, good question. So basically, it comes down to monitoring. Like, we have to do a whole lot of watching and adjusting of the doses. And then I'm also constantly searching for infections in these guys
Yeah.
because, again, insulin resistance is usually triggered by an infection. So, especially in the little dogs, they get bad teeth, right? And that's
Mhm.
pretty common. And,
Right.
and so, if we can do frequent dentals on these patients and jump on those bad teeth, they tend to be better regulated on their diabetes.
Yeah.
And then I like to, like, at least every 6 months do a full panel, and I even if their urine looks okay, I always culture it because sometimes there's infection hiding there, especially because they usually have dilute urine, they're
Yeah.
peeing all the time, or at least frequently, and
Real
they
quick,
have
for a full panel, you mean like basic 17, CBC, urinalysis type thing, right?
yes.
Because we think of a full panel on ER, we think we're doing coags as well.
Oh, no, we don't need to do
Okay.
coag.
Okay.
No.
I just wanted to make
I
sure.
mean, a senior panel. So,
Perfect.
like,
Okay.
I'll send it out because it's not urgent,
Right.
they're not
Right.
dying.
Yeah.
So I do the chemistry, CBC, T4. Usually I'm looking at that
Okay.
in the older patients, and then urinalysis. And then I always add on a fructosamine just to watch that number over time. And then urine culture. So
Okay.
that's what I mean by full blood work
Got it.
every 6 months. And that's after they're well regulated. So initially, when I first see them after you're done saving their lives,
You-
I usually do a blood glucose curve. I
Okay.
like to do curves initially just to see how their initial insulin dose. And so, what is a curve? That's basically checking a blood sugar about every 2, 3 hours over preferably about a 12-hour period between one insulin shot to the next.
Okay.
So, I can see ideally you would see it start high, maybe 300, 400, and they get here and they get their insulin. I usually recommend they give insulin at home
Mhm.
because I like them to eat when they get their insulin shot,
Got it.
and they don't usually want to eat when they come here
Right.
because they're stressed out. So I have them do that, and then right away after that, bring them in. So I'll check, and usually they're still pretty high when they first come in. And then I like to see that blood sugar drop down to what we call the nadir, or the lowest point, usually a few hours after that, and then slowly creep back up before it's time for their next insulin shot that evening.
Okay.
My goal is to have them be somewhere between 100 and 250 for at least a few hours. If I can get there, that's great. And 250 is like a magic number for these diabetic patients because there's something about the kidneys that once it gets over 250, they can't keep it in the blood anymore. And the sugar
it.
goes into the pee, and then all the symptoms of mayhem
Mhm.
starts. So if we can keep it less than 250 for even just a few hours, we don't have those symptoms for that time. And then they're just overall a happier patient.
Yeah.
And it's hard to get perfect. If they're 300 to 400 for their next insulin shot, that's probably as good as we're going to get. And
Yeah.
I'm fine with that. I don't want them to get too low because that's where we run into trouble. It's a lot more life threatening to be too low than too high
Yeah.
with that blood sugar. So if they're like less than 100, I usually think that dose is too high. And if they're never getting below 300, 400 the whole day, then that's obviously not enough insulin. And we need
Right.
to either go up with the dose or start searching for infections. Do we have something else causing insulin resistance? There's a whole lot of looking and watching and
Yeah.
rechecking.
And how long after we've started the insulin do you want to do a glucose curve?
Good. Anytime we adjust the dose or initially start the dose, about 2 weeks later, it's good to check a curve. And then I will recommend it every 2 weeks if we can after any adjustment on the dose until we have that good curve where we're between 100 and 250 for a few hours. Then I'll stop there and just go to the every 6 months.
Okay. At that 2-week point, let's say we have them seen on ER and then we're going to have them rechecked with you in 2 weeks. Should they expect to do that insulin, like glucose curve that day? Or is it like you just evaluate them first, see if their symptoms and stuff have resolved, and then schedule for a glucose curve after that?
The latter is what
Yeah.
I prefer because I like to touch base with the owner first and then come up with a plan for that 1st
Mhm.
curve. Because sometimes they don't even know that they're supposed to give it before they bring them in, or they come in at 3 o'clock and they want their
Right.
blood glucose curve. And I'm like, no, it has to be in the morning.
Right.
So I would say just come talk to me first, get established with my care, and then we'll talk about the monitoring going forward,
Okay.
ideally. I understand that's not always possible. So sometimes it gets scheduled properly and they come in early and they have already given the insulin. Or they bring it with them and we can
Right.
just try and see how it goes. But yeah, ideally, I would like to talk through everything. I have a whole discharge instructions that goes over all of this stuff
Nice.
that I like to sit down and talk to them about first
Right.
and then go from there. Yeah.
And then when the receptionist schedule that, then they should probably talk to them about the fact that it's going to be like an all day thing. The animal will be there all
Yeah,
day.
absolutely. Yeah. Yeah. And then again, if I don't tell them about that myself, maybe on ER, you can prepare them for that. But I feel like that's too much work for you. So it's
I
like,
feel like we don't always know which testing is going to be the test that's done. You're like,
yeah.
you really like doing the glucose curves. Dr. Tobiasen really likes doing
Mhm.
the Nacho Libre,
Oh,
the
yes. Let's talk
Freestyle
about the
Libre.
Nacho
Yeah, let's talk
Libre.
about that one. But she loves doing those. So it's always hard to know which doctor prefers to do what and
Yeah.
which one they're going to be making an appointment with. So I always think that having them just check with you first, do that exam first would be great, and
Yeah.
then schedule for whatever it is afterwards.
Yeah. So I feel like you should introduce the Freestyle Libre a little bit better just for the podcast sake.
Yes. So we
You
have,
should say, what about the Freestyle Libre?
yeah. Tell me, wait, what about the Freestyle Libre? What is that?
Oh, you mean the Nacho
The
Libre.
Nacho Libre. That's what I was called during rounds. I cannot remember what it is for the life of me because it really Nacho Libre should be its name.
Yeah. I don't know. That's just the first thing I thought of when I first heard of this device.
Yes.
Because I think that movie's pretty fun. But
Right,
anyway,
exactly.
so the Nacho Libre is a device that it sticks to the skin and it tests not in the blood glucose levels, but between the cells and the interstitium glucose levels, which kind of lags behind the blood glucose levels about 5 to 25 minutes. So
Yeah.
it's not super accurate, but it's pretty cool because it's just constantly monitoring. And if it stays on, it'll keep monitoring for about 2 weeks before
Yeah.
it shuts off. So I find it very useful in the ER when you guys have these critical patients that you need to be watching all the time, then you don't have to poke them all the time.
Right.
And you can just see where their sugar's at constantly as you need it. I find it less useful for the home patient for a few reasons. First, it can fall off. Like
Yeah.
that happens a lot.
Yes.
Like it doesn't last the full 2 weeks.
Yeah.
Sometimes it does, which is great, but a lot of times it falls off after a day or two. And then it's just like a one-time thing, right? So sure, great, it lasts for 2 weeks, but then what? We still have to keep monitoring this patient like for his whole life.
Yeah.
So we could just keep putting on more Nacho Libres like over and over and over. Or it might be useful to just have a glucometer at home to check a single blood sugar or even do curves at home
Yeah.
anytime that you want. And those machines you have forever. You just buy the one.
Right. And do you always talk to them about using the Alpha Track one, the same one that we use?
Yes. I always encourage owners to get their own glucometer just to have that power to be able to check them whenever they can. And I usually recommend they come in so we can show them how to use it once they get their own. And I talk to them about doing monitoring at home with it as needed. So I actually like that better than the Freestyle Libre.
Yeah.
Just because, again, they always have it. But
Do you like them to do like a curve at home as well?
yeah, so it's a lot cheaper for them to
Mhm.
do it at home if they have their own glucometer and they're comfortable getting it and
They're not stressed.
and they're not stressed. And
Yeah.
then, yeah, but so it takes like a willing owner
Yeah.
and a willing patient. Like
Right.
not all cats are going to be cooperative at
Yeah.
home or here. And so sometimes it just can't be done. But I always try and encourage and let people know that's an option. And yeah, but if they can do a curve at home with the glucometer, then it's cheaper and it's less stressful for the patient. And they can just email me the curve. You don't even need to come in.
Do you charge extra for doing?
I do. Like for normal emails, I don't charge anything, obviously. But
Right.
for any time I interpret a curve, like the owner does a full curve, I'll
Yeah.
charge a telemedicine consult
Okay.
fee, which is like a little less than an exam, I think.
Nice.
So yeah.
Okay. So it seems way cheaper than them staying here.
Yeah.
12
Usually
hours.
to do a curve in the hospital, it's around 300 now to spend the day with me and do it. Maybe a little more if I want to run a fructosamine or
Yeah.
a urinalysis while they're here or something. And then if they buy a glucometer, I think it's like 100, 150 now on Amazon. And they can use it for the rest of the patient's life.
Yeah. And I think now they have the Alpha Track 3. if I
Yeah.
remember
Oh, yeah. And it
correctly.
like connects to
Yeah.
an app and stuff,
Mhm.
makes it pretty easy.
'Cause they're not even making the Alpha Track 2
I
anymore.
heard that.
Yeah.
Yeah. So all of those test strips once they're out. We can't use those
Can't use it
anymore.
anymore.
That's a
Yep,
bummer.
exactly. But it's cool that it connects to something so they can send you that rather than writing it
Yeah,
down for you. And it shows them the curve and stuff on it, if I remember correctly.
that's cool. Yeah,
Yeah.
I look forward to getting those.
Yeah.
Yeah, so I like the glucometers. If they did the Nacho Libre, I believe it's 200,
It's about 200 each time we
250.
put it on. Yep. And
Yeah.
again, it connects to an app on their phone
Okay.
so that they can like view it over that 2 week time period. But the thing with the Nacho Libre, you have to have your phone next to the patient at least once every 8 hours for
Okay.
it to be able to read that whole thing. So let's say if they were gone for 12 hours at work, you're going to miss a bunch of data points from the very beginning.
Oh, interesting.
Yeah. So they do have to be by it at least once every 8 hours.
Huh.
Yeah.
I didn't realize that. Aren't there some that come with a wand?
Yep. The wand. Yep. And the
And you
same
can't just
thing.
leave that with the cat?
Then it's not going to track all of it is the thing. Like
Oh,
usually, I guess you can go into the history and probably that would be better. But yeah, I
okay.
do know that the wand is more expensive than doing the other one. And then I don't know if the wand, I don't think that you can send it anywhere. So
Oh,
they'd have to write all of it down for you
okay.
to be able to send it to you.
Okay.
We'll have to ask Dr. Devison for sure.
Yeah,
But
she uses those a lot
yeah.
more. Yeah. Yeah, that's definitely an option. But again, it's $200 every time
Mhm.
versus an alpha check. You can do it whenever and you
Right.
just have the one.
If they do it at home, how often would you do fructosamine then?
That I usually just do on the 6-month checkups
Okay.
if they're otherwise doing well. I've had a few patients where the owner just was unable to do curves, whether it was the owner didn't want to or the patient didn't want it to
Yeah.
happen. So those ones I've sometimes just gone to checking fructosamines because we don't have any other options.
Right. Especially if it's
And
a real mean cat and they're not going to withstand being in the kennel for 12
yeah,
hours for you to poke them.
I mean, we could try and bring them in and hold them down and put a Nacho Libre on them and send them home with
Right.
that, but that's pretty stressful to
Yeah.
do.
So you got to shave them.
Yeah.
Yep.
I guess getting a fructosamine is stressful too. It's sometimes you just do the best you can,
Yeah.
with what you got. And
Yeah.
I also use the symptoms a lot to tell me how they're doing.
Yeah.
So if they're not drinking a ton and peeing a ton and they're not losing weight and wasting
Right.
away, those are usually signs that they're pretty well regulated.
Yeah.
So we might just stay right there, that insulin dose.
So I will ask you a question that's not on our thing here real quick. So I get a lot of diabetic patients from other hospitals
Okay.
and they are told to just give the insulin as they see fit. If you feel like the cat only needs 2 units, give it 2 units. If you feel like the cat needs 3 units, give it 3 units.
Wow. They're told to do that?
I can't tell you how many diabetic patients I have seen that have been told to do this. Not from our hospital,
Wow.
but from other hospitals.
I'm just wondering what parameters they give the owner to decide if it
Mm.
needs 2 versus 3.
If they feel like they've been drinking more water that day.
Yeah.
That's mostly the excuse that I've heard that, oh, if it's drinking more water, just give it more insulin that day.
Yeah.
And then go back down to the regular 2 units when it's okay.
I think if it was a range that was reasonable, I'd be all right with that.
Okay. What about those patients that don't eat their full meal?
Oh, then I'm a little more cautious, right? We want to avoid hypoglycemia.
Right.
So we don't want them to get too low with the blood sugar. They can have a seizure and die. So if they're not eating, one, I'm like, why aren't you eating? That's not good. Are you feeling sick?
Yeah.
But I would probably do a half dose of insulin that day. And then if they are not eating by the evening, I would not give insulin at all
Okay.
and bring them in because
Yeah.
there's probably something wrong if they're feeling like so bad they don't want to eat anything. And we need to probably figure that out before we keep going with their.
Yeah. So what is the expected lifespan of a pet who's diabetic?
So if we're well regulated, I would say a normal lifespan. If we're poorly regulated, like we just can't get a handle on that glucose, whatever, for multiple reasons. And they have liver problems now too. And they also have a heart murmur. They sometimes have comorbidities that can influence their prognosis. Those ones I would say probably shorter than typical. And there can be complications that come with poorly regulated diabetes too, like infections can get worse, liver problems, muscle wasting, skin infections, eye problems, all of that can over time add up to decrease their quality of life and then make it probably kinder to think about euthanasia at some point. And if you don't treat it, it's fatal. Like I don't think they would live more than a few months probably.
Yeah.
Before they die from it.
Yeah.
Yeah.
Sad. But at least it's something easily treatable. At least giving an injection twice a day is not as bad.
Yeah. I think it can be shocking at first, but you'd be surprised how many people are willing to give it a go.
Yeah.
And I'd say at least the ones that I see are up for trying.
Yeah. Yeah, absolutely.
And then I'm here to help guide the plan a little bit.
How long can insulin be left out of the fridge for? I feel like this is a very common question
Yes,
for our receptionists.
it is. So 28 days, there was some study that showed it's still effective at room temperature
Nice.
for up to 28 days before it starts to lose its efficaciousness. Even after that, it probably still works, maybe just not as well.
Mhm.
We recommend that you refrigerate it just because it lasts so much longer
Right.
when you do, and it's expensive. And I think in the human field, they recommend tossing it after a month. Is
Yep.
that right? But for veterinary medicine, we let you keep it for about 6 months before you toss the bottle.
Yeah. I don't think that they even necessarily say that they need to keep it in the refrigerator for humans. I think they say that it's better to keep it in the refrigerator but that's part of it is like it only lasts for a month. But most of the time they're getting so much insulin anyways, it's usually done by a month. Like they've already used up their bottle.
Right.
you
So
know?
it's almost gone anyway.
Right.
Yeah. For cats, especially, that you need such a small amount that
Mhm.
one bottle lasts a very long time.
Right.
So if you can keep it in the fridge, it'll be efficacious the whole time.
Yeah. Even for Glargine, I think we sell it by the 1 mil,
Mhm.
right? Yeah.
Yeah. It's depending on the cat, because that would be 100 units, right?
Right. That's like almost
So if you're only
100
giving one
doses
unit,
for some of the cats. Yeah.
some of the bigger cats, you're giving 2 or 3 units
Right.
to, it'll go through faster.
Yeah.
But yeah. But if you keep it in the fridge, if you buy a 10 mil vial or something from a pharmacy, then
They'll
it'll
last a
last
cat like
a
10
long
years.
time. Yeah. I think we say generally 6 months you should top.
Yeah. Okay.
Oh, you had asked about some guidelines on the glucometer at home.
Oh, yeah. Yeah.
So if it's too high or too low, what do you do? So if you're checking and it's less than 100, 90 or something, I would just give them some food
Mhm.
and then check again in an hour, see
Okay.
where we're at. If we're going back up, great, we're fine. If it's ever less than 50, that's more concerning. Like that's where we start running into trouble.
Right.
And so I would get something super sweet like Caro syrup and just squirt it in their mouth because you can absorb glucose just through your gums. You don't even have to swallow it. And then I'd probably just bring them in
Yeah.
to check things, see if they need some supportive treatments.
Mhm.
Because if you gave too high of a dose of insulin or something, that could keep going on, and
Right.
they might need to have more
Yeah.
treatments and dextrose or whatever you give IV.
Yep, dextrose, especially because the fact that these are usually long-lasting insulins, right? So
Yeah.
it's meant to last for 12 hours at least, sometimes 18 hours.
So I would
Yeah.
just put the Nacho Libre on them and
Yep.
check for a day or two
Right.
in the hospital before you let them go home.
Yeah.
If it's always 300 to 400 or higher, that's not an emergency like the low blood sugar is, but probably means that there's something we could tweak to make it better. Because again, I like it to be below 250
Right.
most of the time if we can. So then I would say if it's not already time for the 6-month checkup, come on in and we'll just run everything and
Right.
try to recalibrate where we're at.
Make sure there's not some sort of infection or anything that's like making these things
Yeah.
worse, right?
Sometimes they'll just get a UTI and that's
Yeah.
all it was. Or sometimes, like I had one owner, we were struggling and he finally, we just went over everything the dog was eating. He's like, what about these treats? And they were like really high in sugar.
Yep.
And I'm like, oh, let's stop those.
Yeah.
And everything got a lot better
Oh,
after
good.
that. Yeah.
Yeah, definitely the diet, I feel like plays a lot into
Yeah.
this. I definitely get a lot of diabetic patients that are like, I just fed him pedigree. Okay.
Yeah, they can eat anything really, but it's
Yes.
going to make it harder to regulate them
Right.
when they're not avoiding sugars really.
Right.
That brings me back. There was one patient also that I switched to a different kind of insulin that I
Mhm.
forgot to talk about earlier. It's called Levemir or Detamir
Oh, yeah, yeah.
insulin. It's a very potent insulin. So it's still U100,
Right.
but it's like way more, like 10 times more potent than regular NPH.
Yeah.
So you only need like, you start every animal on like 0.1 like units, hardly anything.
Wow.
Or
So
0.1
definitely-
units per kg, I think is what it is.
So definitely not something for cats.
No, only for
Pretty much for
dogs, the only ones
dogs.
that are a little bit
And bigger.
bigger. Yeah.
Yeah.
This one I did was like maybe a 20-pound dog, so it wasn't
Okay.
huge,
Yeah.
but we were just maxed out with her insulin dose and I was at my wit's end. Like
Yeah.
we just done a dental. She just called her urine and it was negative.
Right.
And she was eating the right foods and all that stuff. And so I think she just needs more insulin.
Yeah.
And I don't want to keep going up with this one. So let's try this one. And boom, she was like perfect.
Nice.
Yeah.
And this is something you can still write a prescription.
Yeah.
Take it to a pharmacy.
Yep.
Yep.
Yep. It's just another type of insulin. It's not for every dog. And I wouldn't probably start them on it. But
Right.
some that are, you're just like, can't get a handle on it and they need a really high dose, maybe switch into this because then you don't have to give as much either. And it works pretty nice.
Would you consider it for like a giant dog, like a St. Bernard or something?
Probably still, even then, I wouldn't
Still,
start them on it. But might be more ready to switch to it.
Yeah.
If we were having trouble.
Yeah.
Yeah,
Okay.
for sure.
Cool. Real quick. So I always do like a funny story from my week, but I feel like I just never have a guest on.
Okay.
So I feel like I just want to ask you a question then.
Okay,
So
sure.
what is your favorite type of animal?
Oh, that's a tough one. Um, I have to say cats because
Okay.
I just love them. But also horses jump to mind. I used to ride horses
Mhm.
and I just think they're so beautiful.
Mhm.
So one of my daughters is riding in Spanaway. There's
Nice.
a place that we take her to. So it's
Yeah.
fun to watch her ride.
Very cool.
Yeah. Maybe one day I'll get back into it.
Yeah.
Too busy.
Should ride while she rides around.
Yeah. I'm only just like to look at them now.
I like to look at them from very, very far away.
Aren't you allergic?
I'm very allergic
Yes,
to
you
them.
told me
Yes,
that.
yes.
Oh,
Yeah, so they're really nice, way far away from me.
okay. Oh, sorry.
It's okay.
Yeah, I'm always impressed with vets that are allergic to their patients. I'm like, how
Yeah.
did you ever start
Mhm.
doing?
Yep, yep. I even actually was like, I'm still allergic to dogs and cats, but I've done all the allergen testing, or
Okay.
sorry, all the allergen shots that you can do for
So
all
you've
of them.
desensitized.
Yep. So
Good.
desensitized for so I'm pretty good with dogs and cats now. Still not as great with rabbits, but still I can at
Mhm.
least be in a field with a horse now and not have an anaphylactic.
So is that bad?
Yeah.
So have you tried desensitizing to
We did.
horses too?
We did. Yeah. We
And-
did the whole shots to desensitize to
Okay.
them. And that's pretty much as close as I can get now.
Do you have an EpiPen with you? Just in
Yes.
case? Okay, good.
Yep. I always have an EpiPen because especially we have a lot of clients that come in with their pets that have been around horses. And so it hadn't happened for a while. The last one before the couple weeks ago was with Dr. Van Maren. She brought in her dog her dog that she had been fostering,
Mhm.
and she put like the horse halter around the dog to keep it in the back seat.
Okay.
And then the dog came into the office and it was fine. But then as soon as I pet the dog, I started going into an anaphylactic reaction. And I was like, I don't know what I touched. Like this feels like I've touched a horse. And she was like, oh, shoot. I put the horse halter on the dog. And I was like, I got to step out for a couple minutes.
Sorry.
Yep.
It's that sensitive. I'm
Yep,
so sorry.
it's crazy. Yeah.
Yeah.
So you can enjoy the horses for me.
Okay, yes.
Yeah.
But yeah, I think I like cats and horses.
Nice.
I like dogs too, but something special about kitties. I don't know.
Yeah. I think cats are very much like horses. That's what people say. They're very much like a horse. So, all right. Thank you, Dr. Z. I super appreciate you being on here for diabetes. I learned a lot already today, so that was fantastic.
Good. Me too. Thank you so much for having me. It was super fun.
Awesome. And hopefully you'll be on the podcast again. I'm sure people are going to ask for more general practice stuff that I don't know about. So.
I'm happy to help. Yes. Absolutely.
Perfect. All right. Thanks.
Thank you.
Thank you guys for listening this week. If you have any questions, comments, suggestions, or you just want to say hi, you can email me at shugs, SUGGS, at vetsplanationpodcast.com, or visit the website at vetsplanationpodcast.com, or find us on Facebook, Instagram, or TikTok at Vetsplanation. Thank you all for listening, and I'll see you back here next week.